Hello everyone, I am Dr. Suresh, Faculty of Biochemistry, and in this video we will see the minor metabolic pathways of carbohydrates. Right, in our previous videos we have seen the major metabolic pathways like glycolysis, TCA cycle, HMP shunt, glycogen metabolism. Right, and here we will see minor metabolic pathways in the sense the other reducing hexoses, galactose, right, and fructose. Because fructose itself having a transporter in our body, GLUT5 is specifically aligned for the transportation of fructose, right? And galactose also will be transported by one of the transporter. So what is the source of galactose? Lactose is the source of galactose in our body. When lactose undergo digestion, it gives galactose and glucose, right? The principally dietary source of galactose is lactose. The enzyme responsible breaking of lactose, that is lactase, which is having the hydrolyzing enzyme activity beta galactosidase. Beta galactosidase. Beta galactosidase, that means it break beta 1,4 glycosidic linkage between galactose and glucose. Okay, it is present in the brush border of intestinal mucosal cells. And galactose is also produced by lysosomal degradation of glycoproteins and glycolipids, right? Because galactose is one of the sometimes free galactose, otherwise modified galactose, galactosamine, right? Sulfated galactose amine. So like that, if you break the glycoproteins, in that condition also galactose will be formed. And galactose is metabolized almost exclusively by liver. And therefore galactose tolerance test is done to assess the functional capacity of the liver. So estimation of galactose is also one of the diagnostic use in checking the healthiness of liver. It can be act as a diagnostic marker for liver. UDP galactose is active donor of galactose during synthetic reactions. How UDP galactose we'll see in that. First one, how galactose is metabolized. Okay. Galactokinase. Galactose is first phosphorylated by galactokinase to galactose 1-phosphate, similar to glucose 6-phosphate, how it forms glucose to glucose 6. So here galactose phosphorylated, because glucose, galactose both are 6-carbon compounds, both are aldohexoses. Okay, so glucokinase phosphorylates glucose, galactokinase phosphorylates galactose. And galactose 1-phosphate uridyl transferase, the enzyme, okay, this is a rate limiting enzyme in galactose metabolism. Galactose 1-phosphate uridyl transferase, which transfers galactose to UDP. This step where you have learnt, this step is similar to glycogen synthesis, where UDP, UTP and glucose 1-phosphate will be combined to form UDP glucose, and phosphate will be removed, that is pyrophosphate will be released, right? Same way, now glucose 1-phosphate reacts with UDP glucose to form UDP galactose, okay. And here not UTP directly, but UDP glucose will be there. So in place of glucose, galactose will go and bind, and glucose 1-phosphate will be released in presence of enzyme, and this glucose 1-phosphate will be converted back to glucose 6-phosphate, and it will be involved in gluconeogenesis or free glucose formation. And galactose 1-phosphate uridyl transferase is the enzyme. What it will do, UDP galactose is an active donor of galactose. UDP galactose is essential for the formation of compounds like lactose, glycosamino GAGs. Why we want galactose in our body? Because we want to synthesize complex carbohydrates like glycosaminoglycans, glycoproteins, cerebrosides and glycolipids. If you see their composition, galactose will be there. Okay, the carbohydrate moiety that present in complex molecules like glycolipids, glycoproteins, cerebrosides, modified galactose will be there, not some amount of glucose, sometimes galactose. Step 3, epimerase reaction. UDP galactose can be converted to UDP glucose by UDP hexose 4 epimerase, and galactose is channeled to metabolism of glucose. Galactose is not essential nutrient, since UDP glucose can be converted into UDP galactose by the enzyme UDP hexose epimerase and requires NAD plus. And galactose is not essential in the diet because we are getting in via lactose. Okay, galactose obviously will be provided, milk and dairy products. And galactose metabolism is like alternative pathway. The galactose 1-phosphate phosphorylase is present in liver and becomes active only after 4 or 5 years of life. The enzyme will produce UDP glucose directly, which can be